much. I'll get situated here. Can you see my screen?
Yes, I can.
Okay, perfect. Oops. All right, so I assume that the announcement went out and folks expected to see Paul Bradley, my colleague, in front of you today. However, he is unfortunately dealing with a family emergency. So you have me. I am on my second hour of talks today, so please bear with me. I wanted to, I'm sure looking at this crowd, a lot of you are familiar with the USGS and did a nice job of summarizing where I work and what I do. But for those of you that aren't really familiar with the USGS, we are a science agency. We have about 68 science centers across the nation. There is one in Nebraska, the Nebraska Water Science Center. And then our science is divided up into what we call mission areas. And there are 5 of those. And Paul and I work for the ecosystems mission area. And there's 22 programs within the USGS, and we work within the environmental health program. So all the work that I'm going to be talking to you about today is funded through that ecosystems mission area, the environmental health program. And Paul and I co-lead the drinking water and wastewater infrastructure integrated science team. And since that is such a mouthful, we shorten it to the Water Infrastructure IST for short. This diagram is meant to give you a real understanding of the human impacted water cycle. And that's kind of where we work. And so in that human impacted water cycle, wastewater and drinking water, particularly in surface water systems, and as the climate begins to change and we're having water reuse and things like that, they're intrinsically linked. So our team separates our research just for ease of discussing, separates them into a wastewater component where we're really focused on exposure and potential effects of contaminant mixtures. So these are both organic and inorganic contaminants in wastewater as well as stormwater, with an emphasis on ecological exposures. And then what I'm going to talk about today is our drinking water research. And that's really focused on understanding human exposure as well as potential effects of these realistic contaminant mixtures. And what kind of makes us stand out a little bit is that instead of collecting samples from your drinking water resources like groundwater wells and surface water reservoirs, or the drinking water treatment plant, we actually go into people's homes and collect samples, at the point of use from their tap. And we've also done a study with bottled water as well, which I will also discuss today. So when we think about these drinking water resources, there's a huge gap between the complexity of what's actually in the environment versus the actual regulation. So depending on what inventory or what publication you like, whether you're thinking about the TOXCA inventory of 85,000 chemicals, the paper by Wang et al. From 2020 that characterizes potentially 350,000 chemicals, or the CAS registry, which shows greater than 1 million substances are actually produced, with what's actually regulated. So the National Primary Drinking Water Regulation has about 90 contaminants that it regulates. So when we think about that environmental complexity, the first question that we had was, what do these drinking water resources look like? And what are the contaminant mixtures that we're most likely to see? And so in 2012 to 2014, the USGS and US EPA got together and they collected surface water samples from across the US, and they basically we threw our analytical kitchen sinks at them. So anything that we could analyze from an organic chemical standpoint, we did. So that got us over 700 organic chemicals. And out of those 700, we detected about 400, and 57% of those were pesticides and pharmaceuticals. Now, pesticides and pharmaceuticals are designed to be biologically active. So they're designed to have an effect on an organism. So based on this study, we knew that what you could potentially see in the environment was highly complex and definitely above what was actually regulated in the drinking water treatment system. So the next question was, okay, so we know all of these contaminants are in our drinking water resources. So what happens with the finished drinking water? So again, we collaborated with the EPA, and we went and we sampled 25 drinking water treatment plants, and we sampled the raw water, so what was coming into the plant, and the finished water, what was going out of the plant and moving through the distribution system to the taps. And so what we found, and here we actually included organic compounds and inorganic compounds. So we detected 247 organic compounds and trace elements. And in the intake, we saw 148 compounds at least once. And then although the number decreased, we were still seeing over 100 different contaminants coming out of that treated drinking water. So that's taking us from the resource through the treatment plant. And the next question was, well, what's actually happening at the tap when somebody goes and takes a drink of a glass of water? Because we know that contaminants can change as they leave the treatment plant and move through the distribution system and the multitudes of pipelines, come into the house, make it through premise plumbing, and what comes out of that tap may be very different from what started miles away in the drinking water treatment plant. And public health agencies and decision makers actually came to folks at the USGS and say, we need better data on human exposures to drinking water contaminants. And this is what we need. We need information at the point of use, so at that point of consumption. And we also need information on more than just regulated contaminants. So we want you to take that expanded analytical toolbox that you did in the surface water pilot, and let's transfer that to drinking water and see what the mixtures of contaminants look like across the country. And in order to kind of do that, we had to start thinking about what are the 3 distribution pipelines for drinking water in the US. We've got public supply or community water supplies, which are regulated by the EPA. You've got private self-supply or private wells, and of course, commercial bottled water. So public supply and bottled water are regulated. Public supply by the EPA and bottled water by the FDA as a food. So in order for plants to follow regulation, they have routine compliance monitoring. Again, these are regulated contaminants only, so about 90. And again, these samples are primarily collected at pre-distribution. So once that water has been treated. And FDA, their compliance monitoring is done occasionally in the plants. For private wells are not monitored. EPA is not authorized to regulate private wells, so they're generally rarely monitored, mainly because it's cost prohibitive. Also, if you do collect a sample from your well, you have to disclose it during a property sale. So a lot of people don't want to actually do that. In the state of New Jersey, we have the Private Well Testing Act. So actually, before we sell our houses, we have to get our wells tested for the regulated contaminants and then disclose that information to the buyer. And so that kind of just depends on the state. So we may, in certain states, there may be more information on private wells, but all in all, there's not a lot of information on contaminants in private wells. So the approach that we've been taking since 2016 is focused on this expanded analytical toolbox. Our team is pretty good now, and they can sample about 30 bottles in 20 minutes. So they get in and get out of folks' homes. And that's kind of ideally how this toolbox was set up. It was set up to minimize the inconvenience of USGS personnel in people's kitchens. Depending on the study, it ranges from about 400 to 500 organic chemicals. The classes of compounds, we focus on cyanotoxins, so toxins from harmful algal blooms, disinfection byproducts, which are in public supply and they're used during chlorination, so treatment of drinking water, pesticides like atrazine. Of course, I talked about this earlier, PFAS compounds, pharmaceuticals or drugs like metformin, volatile organic chemicals. These tend to be the ones that are actually the most regulated. Things like benzene, TCE, things that you might, vinyl chloride, things that you've probably seen in the news recently. And we also include inorganic chemicals, including major ions like nitrate, and then trace elements like arsenic and uranium. And we also include a list of microorganisms. And as all good USGSers, we collect field parameters like pH, temperature, and specific conductance. So this is done uniformly. It's done across all of our studies. And because if you have any idea, this analytical suite costs a lot of money. And so we have a relatively small budget and can only analyze about 60 to 80 samples a year. So when we go into a community, we're really focused on the community's concerns, but we want to be able to compare broadly across the US and across studies. So for this reason, in order to try to avoid sampler bias and other things as in the data set, we use the same sampling team and the same labs across all studies. We do extensive quality assurance, quality control, and we have a robust, very detailed shipping and handling protocol, just so that we can make sure that all the samples make it to the lab within their holding times. So our approach is also focused specifically on human exposure. So at the tap, so this is a realistic tap exposures. So because they're realistic, we want to simulate what would happen if you walked up to the faucet and got a drink of water out of your tap. So we don't remove the screen or the aerator, because you would not do that when you took a drink of water. We don't clean or disinfect the sink. We do an immediate collection. So we don't flush the sample, and we do not, or the tap, and we do not do a 6-hour stagnant sampling. It's not required. This is not for regulation. And because we don't do that 6-hour stagnant sampling, it's not considered a worst case for contaminants like lead and copper, which can be in the distribution system or the premise plumbing. So we know that if we are detecting these, it's not a stagnant sample. Folks have used their tap prior to us showing up. And so it would not be that worst case scenario. We've been doing this work since 2016. We started with a national pilot, and it was really just focused on collecting samples broadly across the US. We focused on USGS employees and USGS offices. And it was really just to answer the question of, are there contaminant mixtures in our drinking water? And clearly the answer was yes, because we have kept doing these studies. And so we've done a number of studies since 2016. They may not mean much to you all. These are acronyms that we've used, but I'm going to focus on three studies today. And I'm going to start with our 2018 study in Cape Cod. So Cape Cod is very, very interesting. It's a sole source aquifer, and they have folks that are on public supply, and they also have private wells on the peninsula. And they're both coming from the same shallow, unconfined, unconsolidated sand aquifer. So they're both drinking out of the same aquifer. So they should look very similar. There's also some septic impacted areas. Again, sand, shallow aquifer. So there's clearly going to be some septic impacts. There's also a joint base, Cape Cod, which has had some PFAS problems. So we know that PFAS is an issue in Cape Cod. And just to note, because everybody's sitting in front of their computers, the QR codes at the bottom or on the slides are for the papers. And so if you are interested, just scan that QR code and it'll take you right to the paper. If you can't get them and you're interested, just shoot me an email after the talk and I can send you the links. So briefly, and there's going to be several graphs like this throughout the talk. So I'm just going to kind of walk you through and orient you through to this graph. I know that the compounds on the y-axis are small, but that's less important. The importance here is we're comparing public supply on the left to private wells on the right. The concentration is along the x-axis on the bottom. Note it is log normal in order for us to be able to see everything. And then the numbers down the side on the y-axis on the right of each plot, that indicates the number of different detections of that compound. So for example, the top compound is trichloromethane. That's a disinfection byproduct. It was detected 10 times in the public supply and 8 times in your private wells. So this is just kind of giving us an overview of what we're seeing. We're seeing disinfection byproducts, PFAS, as we expected, some pesticides and VOCs. But what's really, really interesting are these 21 pharmaceuticals right here in the red circle. These 21 pharmaceuticals were detected in one private well. They weren't detected anywhere else. They were detected in one private well. This private well owner clearly had some issues with his septic field, and their septic field was impacting their drinking water. And so without studies like this, those people would never have known that, one, they were having issues with their septic system, and two, it was showing up in their drinking water and they were drinking the pharmaceuticals that they were more than likely taking. So this is kind of the difference between public and private supply. Public supply, you do have some information on what you're receiving. Private wells, there's not much. And this kind of dives a little bit deeper into the organic results. On the top plot, we've got the total number of compounds detected, and on the bottom is the sum of the concentrations. So we start with all of the organics, and then we break them up by class. We've got DBPs, pesticides, pharmaceuticals, PFAS, and VOCs. And what's interesting here is if you start and you look at DBPs, so public supply were higher than private wells, as expected, because disinfection byproducts tend to be used in drinking water treatment during the chlorination process. And what's really interesting is the top 6 that show up at the highest concentration. These were the 6 sites that were actually coming or had public chlorine disinfection. The other 6 did not. And then the next thing is then you see our 21 pharmaceuticals showing up here at that high dot on the top. That's the most detected pharmaceuticals. And then we've got PFAS compounds. And so again, as I said it earlier, PFAS are an issue in Cape Cod. So it's not surprising that PFAS were detected frequently, and that the concentrations between public and private supply weren't different. Massachusetts has an MCL for PFAS. It's a combination of 5 PFAS, and it's 20 nanograms per liter. And this was exceeded actually in 1 public supply and 3 private wells. If you take the new EPA proposed MCL of 4 nanograms per liter, PFOA, there were 5 exceedances, and PFOS 4. And then if you take your MCL goal, which is provides a threshold for the most sensitive subpopulations. That's an MCLG of 0. Every time PFOA and PFOS were detected, they exceeded that MCLG. Inorganics, again, inorganics are part of our tap water toolbox. We've got several different inorganics on the bottom. Again, concentrations are on the y-axis, and the dashed lines at the top. So the dashed red line indicates a MCL, so a regulatory level. And then the dashed black line is an action level for lead. And then the purple lines, they're actually non-enforceable guidelines. So for something like aluminum and iron, they have health benchmarks, but they're non-enforceable. And as you can see, particularly for private wells in the white boxes, we are seeing some exceedances of both MCLs and non-enforceable standards. And then typically for our private or our public supply, everything is below an MCL, an action level, or a secondary or an S or a non-enforceable guideline. But one thing to note for lead, and we'll talk about this a little later, is that the MCLG for lead is 0. So there really is no known safe level of 0. And and we are seeing detections of lead above 0 in both public supply and private wells. One way that we think about human exposure is we've got 2 types of risk benchmarks. We look at the exposure activity ratio. And so what this is, it's called the EAR. So what we do is we take the measured concentration and we divide it by this ACC. It's the activity at cutoff. And that is actually the point of departure for the ToxCast concentration response. And ToxCast, you might ask what ToxCast is. So ToxCast is, it's a robot. It's actually a program developed by EPA, but what it does is it deals with molecular endpoints, and its coverage is over 9,000 different organic compounds across 1,000 or so different biological assays. So the robot uses human-centric vertebrates, but these are all in vitro. So they're all in 96 well plates. So they're potentially more sensitive and protective, and they can assume a mixture effect because we have these ACCs for a wide variety of compounds, but they're clearly incomplete environmental contaminant coverage because even at 9,000, that's still only a fraction of what's actually out in the environment. And that transfer to higher levels of biological organization, like to the organismal level, even if we're using vertebrate-centric assays, it's difficult to take it from those assays to person. And it's also organics only. So how we look at these EAR results, or the exposure activity ratios. So this graph on the left-hand side is the exposure activity ratios of individual contaminants. And then those red triangles at the top are our cumulative EAR. So we take all of the individual EARs and we add them up, and that's what you see in the red triangle. So how to interpret this information, if an EAR of 1 means there is an in vitro effects level. And so in these samples, we saw a couple that were reaching 1, but most of our samples were at or above an EAR of 0.001. And this is your precautionary screening level. So an EAR of 0.001 indicates there is a potential level of concern. The ACC has no margin of safety. So it's a very conservative estimate. And it's also what we consider kind of an underestimate, because again, we only analyze for 487 compounds out of the hundreds of thousands of potential contaminants that are in the environment. And then the ear assays don't have a full contaminant coverage either. And these are only focused on organics. So when we think about the ear, it's a really good starting point. It allows us to think in mixture space, but it doesn't bring in the inorganics. So to include the inorganics, we do a toxicity quotient. And that's just based on available human health benchmarks, whether it's an action level, an MCLG, or just a non-enforceable benchmark. We have compiled all those for inorganic and organic constituents. Again, this does not cover the breadth of potential contaminants you could be exposed to, but it allows us to better assess potential risk, particularly to those vulnerable subpopulations, because it is looking at an organismal response, like cancer or diabetes. So the TQ, so we compare the TQ and the ear, and that kind of gives us a better screening endpoint. Again, this is not cohort-based studies. This is just really focused on these endpoints. So a similar graph for the toxicity quotient. Again, the individual TQs are the dots within the box plots, and the sum TQ are the red triangles. So notice the difference between ear and TQ. So a TQ greater than 1 indicates a risk to human health, particularly vulnerable subpopulations, immunocompromised individuals, children, pregnant mothers. And so all of our samples had a sum TQ greater than 1. And then a sum TQ less than 0.1 really indicates there's no risk. So most of our sum or our total TQs for all of these were above 1, but we do have no risk for certain compounds, which are indicated by those individual circles. And again, this is published back in 2021, and you can pick that up with the QR code. I'm going to move next to our Northern Plains nations. So this was our first tribal collaboration, and it's kind of right next door to you all. This was in collaboration with the Strong Heart study. And if you don't know anything about that, it's the Strong Heart study is a Native American cohort. It was focused on North and South Dakota, or is focused on North and South Dakota, Oklahoma, and the Four Corners region. The emphasis was really on cancer clusters and arsenic exposure, and has morphed a little bit more into thinking about diabetes and other diseases in Native American populations. And one of the issues is high arsenic in the Northern Plains. Arsenic is geogenic, arsenic is natural, but a lot of these folks are on private wells, and they are seeing exposure to arsenic through their drinking water. So the idea was to help the tribal nations move some of their drinking water to smaller community water supplies. However, there are a lot of remote folks that it's impossible to actually get them hooked up to community water supplies. So there was a secondary study, the Strong Heart Water study, that was really focused on understanding arsenic exposure in private wells, and then helping them establish point of use or under the sink sorptive media as a way to remove arsenic. So we worked with Columbia University, their School of Public Health, and really wanted to support their drinking water protection and management by thinking about contaminants other than arsenic. Clearly, arsenic is included in our tap water toolbox, but we wanted to put that into context with other potential contaminants of concern. We wanted to look at this in public and private supply. Again, we've got community water supplies and private wells on these 3 tribal reservations. And so in 2019, we conducted a pilot scale reconnaissance. We really focused on the individuals that were part of the Strong Heart Water Study. So these were arsenic specific sites. And it was is really being used as a foundation for potential follow-up studies in the area. The tribes would prefer not to be named. So they've been labeled A, B, and C. You can see about where they're located here on the map. This gives you an idea. In September of 2019, we collected 56 samples from tribal area A, 34 private, and 22 public. And then, oh, actually, that's the total study. That's how many we collected total. And then you can see tribal Nation A would only allow us to collect from private wells, but we were able to collect community water supply samples from Nations B and C. Again, QR code at the bottom will take you to the study. I'm going to go through each one of these graphs separately, but just to orient you, this is our inorganic results, and we're going to talk about the data exceedances of regulatory standards or exceedances of benchmarks. So we detected 30 out of the 34 inorganics that we analyzed for. In our community water supplies across the board, we had no MCL or action level exceedances. However, we did have MCL and action level exceedances in the private wells and health advisory exceedances in both public and private wells. So for arsenic, this is the issue in the area. The MCL is 10. And you can see here that 14 of our 56 samples actually exceeded them. They were all private wells. The community water supplies are in blue. You can see C is kind of just below that MCL, and B, we didn't detect any arsenic in either the public or the private supply. Because there's no known safe level of arsenic, some states like New Hampshire and New Jersey have actually dropped their MCL to 5. And so if you think about, consider 5, 30 of 56 samples exceeded that 5. And then when you drop it to the actual MCLG, all of our samples where arsenic was detected exceeded that MCLG. And this is not unexpected. This is what we expected. Arsenic is an issue in these samples. But uranium, where there's arsenic, typically there's uranium. The MCL of uranium is 30. Fortunately, only 1 out of those 56 exceeded the 30. It was in a private well. Again, the health advisory is 0. There is no known safe level of uranium. Uranium was detected in 24 of the 56 samples. It was only detected in 2 public supply. The rest were private wells. Lead is another one. Again, if you recall, we did not do a 6-hour stagnant sample collection. So this is not the worst case scenario for lead. The action level is 15. Nothing was exceeded, but the health advisory for lead again is 0. And 11 out of the 56 or 20% exceeded that MCL or the MCLG of 0. And it was a mix between private wells and public supply. This is not coming from the drinking water treatment plant. Typically, these are coming from the premise plumbing. So in the home itself. Nitrate is a septic contaminant. It's also a contaminant from agriculture. The MCL and the MCLG for nitrate are 10 milligrams per liter. They're exactly the same. Only 1 sample from the private well exceeded that. However, there's concerns of effects of nitrate at concentrations less than the MCL. down around like 1 or 5 milligrams per liter. And if you drop it down that low, a decent amount of the samples in both public and private supply, it did exceed that MCL. Manganese does not have an MCL, but it does have a health advisory, and EPA does have a drinking water health advisory. It's a lifetime. It's mainly for children. It has to do with neurological issues. But you can see that quite a bit of our samples exceeded that 300. But the World Health Organization has a provisional guidance value that's dropped all the way down to 80. And this is for neurological effects for infants. And in this case, about 22 of our samples, so about 39% exceeded that manganese value. And this is actually becoming something that human health researchers are very much interested in. The effects of manganese, I think, are going to be something that folks are looking at in the future. And then lastly, the acute 1 day for small children is 1 milligram per liter. And so that's bringing that down. And we had 1 sample that actually exceeded that. And lastly, in the inorganics is selenium. We saw nothing above the MCL, and the MCLG is the same. The European Commission has a provisional value of 20. We only had 1 well that was above that. But then there's been some public health research that says that there's issues with selenium down to 1 microgram per liter. And if that's the case, Community A did have a selenium problem, and 9 out of the 56 total sites and 9 out of the 16 samples from Community A had some level of selenium above that 1 microgram per liter. So we also, I know I spent a lot of time on the inorganics, but the inorganics are what folks are really, really interested in this area. Again, we also collected a variety of organics. This graph just gives you an idea of kind of the number of detections and the concentrations, but I'm going to get into that a little more in detail here. This is a similar box plot to what you saw before. And in these samples, we detected 63 out of 476 organics that were analyzed. There are less MCLs and MCLGs for community water supply or organics in community water supplies. But for those that have MCLs, particularly the DBPs and the VOCs, we saw no MCL or action level exceedances. There are quite a few that have an MCLG of 0, including 3 DBPs, which we did detect, and 4 VOCs, which we also detected. So we are seeing some organic contaminants that are above that MCLG value. This plot gives you an idea of concentration and distribution of the organics. You've got a total organics, so a sum of all organics on the top. Pesticides are on the bottom left, VOCs bottom right, and disinfection byproducts typically found in public supply on the top. Again, private wells are the white boxes and public supply are the blue boxes. The DBPs, they tended to be highest. So community B is their drinking water source in the community water supply is surface water. And so DBPs tended to be highest, excuse me, in surface water sources, as well as pesticide mixtures. This is the Missouri River. So you are seeing pesticides in right here in community B. EPA has a MCL for trihalomethane formation, so a sum of disinfection byproducts of 80 micrograms per liter, and we didn't see anything that exceeded that 80 micrograms per liter. Private wells, some of the highest concentrations of organics were in remote wells. We actually saw some petroleum mixtures in several remote wells. So looking at the ear, we do this in all of our studies. Again, an ear of 1 is an in vitro exposure effects. Only one of our samples in community A had a sum ear above 1. Ear of 0.001 is our precautionary screening level. Again, all but several had a sum ear greater than 0.001. You can see from the graphs, the public supply, we have a lot of data from disinfection byproducts and pesticides. So you are seeing quite a few ear exceedances there. For the private wells, we've detected less organics in the private wells. So you're seeing a lot of the sites did not have any detectable, any contaminants that had a detectable ear. So that's good news. When you get over here to the TQ, that brings in the inorganics. I spent a lot of time talking about the inorganics because the inorganics tend to be the issue in this area. A good majority of our samples had a sum TQ above 1. A lot of that was dominated by the organics and then the disinfection byproducts that have MCLGs of 0. And then we had, I think we didn't have any that were below a TQ of less than 0.1. So all the samples have some sort of potential risk, particularly to vulnerable subpopulations. Again, this has been published and is available at the QR code. And the last one I want to focus on is bottled water. So in 2020 was COVID. Nobody wanted us to go into their homes. So we decided to do a bottled water study. And so we basically chose bottles that we could purchase, lots of it online. And so we had both imports and domestics. We only had a couple of imports, so most of them were domestic. We characterized them as spring sourced or purified drinking water. So that's what you see here in the graph here. We've got purified tap water, which is basically tap water that's been purified through an RO, and then spring water. So we looked at inorganics, and for the and then the spring water is imported and domestic. So there's not much difference in inorganics between imported and domestic. We did see some lead. We saw some nitrate, arsenic, and uranium all in bottled water. Again, bottled water is regulated by the FDA, but they use similar MCLs as the EPA, and nothing exceeded the MCLs or the action levels. For organics, we did detect some organics, primarily DBPs, pesticides, and VOCs. We saw more DBPs in the purified tap water, so the purified water, than the spring water. But we also saw some pesticides in the spring water that we didn't see in the purified water. When you look at the ears, we saw a couple of our bottled water samples, particularly a couple domestic samples that exceeded that ear. And then we saw several that exceeded the 0.001, the precautionary screening level. But if you notice here, we have quite a few bottled water samples that are below that 0.001 threshold. Similarly for the TQ, when you bring in the inorganics, most of our samples exceeded that TQ of 1. And all of our samples, if it didn't exceed a TQ of 1, it exceeded that TQ of 0.1. It looks like we only have one sample, this one right here, that was below that TQ of 0.1, indicating no risk. So the reason I'm showing this is really that there's kind of what we we're calling this a shared challenge. So there's issues across all drinking water supplies. And we're really not seeing huge differences between the different contaminant classes. Yeah, we are seeing some nitrate, lower levels of nitrate in public supply than we do in private wells and bottled water. But for VOCs, they're very similar. And so when you're thinking about picking up that bottled water because it's better than tap water, a lot of these bottled waters are just purified tap waters. And then when you think about spring waters, there can be different issues with spring water, like microbial contamination and things like that. And again, this is published as well. This was just came out recently. So you can find that at the QR code here. And that's it. We have been doing this. We continue to do this. We did some work with some of the UNL folks in Nebraska, so that those results should be coming soon. And maybe at that time we can come back and talk about that. Lastly, we're trying to be more present on the internet. So we have a GeoNarrative that does a really nice job of summarizing everything I just talked about, and then all of our publicly available data is up in an interactive map that folks can play around with and see what we're detecting. And with that, I think I have a couple of minutes for questions. So thank you very much for listening.
Great. Thank you, Kelly, for walking us through your data and for sharing the research that USGS has been working on. It was very interesting to hear. So for those of you who have questions, you're welcome to either unmute yourself and ask them live since we're all on Zoom, or you can put them in the chat.
Yeah, I'll ask a question. I'm not quite sure if you looked at forever chemicals per se, or did I miss that in the PFAS distinction? Because that's a new category of research, I understand.
Yes, we did look for forever chemicals, and those are the PFAS compounds.
They are. Okay.
Yes,
thanks.
yes. And we did see them a lot.
Right. Yeah.
So if one wants to find out a consistent body of data for the entire United States, that would say something about the water quality of the water that people are drinking. What would that be? And what would be the granularity of that data set? The smallest level.
So for chemical by chemical, there is data available. There's quite a bit of information on arsenic. The one graph that I showed of the arsenic map, that was a predictive map of arsenic across the country using publicly available data in groundwater wells. There is data on regulated contaminants from public supply drinking water. They are required to release that. I'm not sure if that's got to be housed somewhere, but that would be probably a question for the EPA. EPA has several studies. It's called the Uncontaminated Monitoring Rule, the UCMR, and they sample certain unmonitored or unregulated contaminants, and they do that every couple of years. They've been focused on PFAS, so that data is available. That is, again, just in public supply. So the data that's lacking is private wells for a wide variety of contaminants. I hope that helps. That there's a lot of data, I think.
Great talk. I wanted to ask you if any of this work is used to inform contaminants that are included under the UCMR rule.
Probably not as of yet. I feel like they've I know lithium was added to the UCMR5, and I believe that was based on some work that folks at the USGS had done. We haven't added lithium yet to our suite. We probably should, but not that I'm aware of. I would love it if they did, but I don't think they have.
I thought of one other quick one. So I don't know if you did in this talk, but in the earlier talk, you discussed how drinking water quality is influenced by wastewater effluent.
Mm-hmm.
I noticed you did that on the Cape Cod study. How are you including that assessment maybe for larger systems?
So we use pharmaceuticals as an indicator of humans. So particularly septic systems, as I showed in the Cape Cod, but it's also a really good indicator of wastewater. So we tend to use pharmaceuticals. Clearly, there's other things that you can use. Folks have used caffeine, sucralose. Caffeine is in our method. Sucralose is not, but sucralose is very similar to the pharmaceuticals.
It seemed pretty unusual for just one well to have that many pharmaceuticals. Did that strike you as an anomaly, or because you just didn't see that anywhere else, right?
No, you
I mean,
didn't.
that kind of concentration. I mean, they're all what kind of pharmaceuticals were they? And well,
I would have to go back and look, but they basically the way Cape Cod is the way things work on Cape Cod is basically they have a private well and they have a septic field that is way too close to their private well. And it's a sand aquifer. So everything that happens up in the ground just goes straight into the aquifer. So they're basically, this sounds disgusting, they're drinking their septic field. And so that's something that actually the homeowners were really happy to know. And if we hadn't done the study, they would have no idea, I guess. I would think close proximity, maybe you don't want to be drinking that, but it is an anomaly, but it also illustrates the importance of this kind of work in an area where there's either a sandstone aquifer or there's a lot of private wells.
because I would think it could be more common. So you only found it in one. So that was interesting.
In Cape Cod, yes, we've only found it in one. We have in other areas where we've sampled private wells, we have found pharmaceuticals. We did a study in Iowa focused on kind of an agricultural cohort. Some of those areas, we did see quite a bit of pharmaceuticals in their drinking water, again, indicating that their septic field is pretty close to their drinking water.
I have another question. When you were, or your group were testing water at kitchen sinks and etc., how did you decide which households to, or which taps to test? And did you do anything? So I'm thinking that there might be a selection effect there, because I remember you mentioning that you went to the places that the communities wanted you to go to. Did you do anything to balance out the bias, the selection bias, perhaps?
So that's a great question. And so within a community, most of the folks that we're working with, we're working with the community liaisons or the public health folks within those communities. And so they are responsible for finding the volunteers. Sometimes that is random, sometimes it's not, based similar to the Strong Heart study. We went to areas where they had sampled previously, so we knew that we were going to find arsenic, because those were the homes where they'd sampled arsenic previously and had installed point of use in some of those homes. But more broadly, so we try to do these spatial synoptics. So we try to answer community level questions where there could be some bias. And again, these are very small sample sizes because our analytical costs are about $5,000 a sample. So we can't afford to do hundreds of samples in a community. So yes, we could have some community bias, but we try to scale it up to start comparing things more broadly, which is why we go through that intense QA/QC procedure. So yeah, so I do think there's some community bias, but I think when you think about it from a national scale, we're not biasing. There's not as much bias. It's just a little more uncertainty.
Okay, thanks.
It was a great question, though. Made me think. Yes, atrazine. I just saw something pop up in the chat. Atrazine is an insecticide. I think I had it listed as a pesticide. I mean, atrazine is an herbicide. Yes, absolutely. It was listed on that toolbox as a pesticide. And if I said insecticide, I apologize. It's been a long day.
Is there a list somewhere on your website that shows like the individual compounds that are within each class?
Yes. If you go to that, I'm going to share it again, just in case you didn't get to take a picture of it. If you go to this website, it will take you to at the bottom, there's going to be a list of USGS data releases. And in those data releases is the entire list of everything that we measured in each study. And it's very similar across studies. I can also probably just send you a list if you follow up with me afterwards.
Okay, thank you.
Well, it looks like we're at the 4:30 mark. So if we don't have any more questions, I think we can call it for today. Thank you, Kelly, for speaking with us. And thank you, everyone, for joining. We'll be back with a hybrid event again in 2 weeks, April 19th. So we hope to see you then. Thanks, everyone.
Thank you all. I appreciate it. Great questions. Thanks for hosting.
Absolutely. Glad to have you.
Thanks. Have a good one.
You too. Thank you.